Have you experienced shortness of breath during chemotherapy? In this video, I'll talk about the different things that can cause shortness of breath and what can be done to help. Before I do, I'd love to invite you to subscribe to our channel. We are always putting out new content. So why would chemotherapy cause shortness of breath? Well, there are a few different ways, and the most common are anemia and decreased exercise tolerance. So if we spend even just one day in bed without moving, we actually start losing muscle mass. It only takes one day, and chemotherapy affects your ability to stay active. If you're not working during chemotherapy, you might not be climbing stairs or walking down the halls or running errands like you usually do. So we get deconditioned really quickly, and one way that shows up is with decreased exercise tolerance and deconditioning. The anemia that happens with chemotherapy can be quite subtle or it can be quite severe. It depends on the type of chemo you're getting and whether you have pre-existing anemia. So let's say you have pre-existing anemia and you've been managing just fine. Even a small decrease in the mass of red blood cells in your body can make you symptomatic. And this shows up with things, especially with shortness of breath on exertion. So you're climbing a flight of stairs and all of a sudden you're short of breath, much when you never had problems with this before. And while it can be from deconditioning, anemia needs to be ruled out. And when you get chemotherapy, your medical team is checking your blood regularly because they're looking for things like low red cell count, which is anemia, low white cell counts, and low platelets. So that information should be readily available without any additional testing. There are additional tests that are done in people who are found to be anemic to figure out the cause. Are you losing blood? Are you not making blood? Are you missing some of the building blocks of red blood cells? So you may, if you're anemic, have additional blood work done. The other thing that can happen, and this is much less common, is a reaction to chemotherapy. So actually a chemical pneumonitis, an inflammatory response to the chemotherapy. Again, this is pretty uncommon, but there's really no drug with which this doesn't happen. It's idiosyncratic, so even if you've had allergy problems to other medications, it doesn't mean you're going to be allergic to chemotherapy. And each chemotherapy, it's really unlikely you're going to have a reaction to every single chemotherapy. So again, this is pretty uncommon, but it can happen. We diagnose it usually with an X-ray or by ruling out other things that it could be. And so it's a little bit harder a diagnosis to make, but it's one that needs to be on the list for all physicians taking care of people who are receiving chemotherapy. And then the third most common category would be an infection of the lung. Now, it's often the case people think that they're going to be really susceptible to things like pneumonia, and unless one's blood cell counts, white cell counts, are really, really low, you're actually not any more susceptible than you were before. It's just your tolerance is a lot lower, and we can't give chemotherapy to somebody who has an active infection. So by that I mean something in the lung, not a bronchial infection or a cold, an upper respiratory tract infection. Those should not lead to shortness of breath. So if you are having, especially with fevers, and even without fevers, an infection in the lung in particular needs to be considered. So shortness of breath from deconditioning plus anemia, anemia alone, uncommonly a reaction to medication, and then infection. If you have a pre-existing lung condition like asthma or COPD or a heart problem, you may be more likely to experience not the reaction to the medication, but to experience shortness of breath with lower levels of anemia, with a less severe infection. So it's important to let your medical team know everything in your diagnosis, everything in your history, and make sure that when you get symptoms, you let them know soon. If you're worried about something, if it's new, if it's different, that's a good reason to call your medical team. And if it turns out to be nothing, you made their day because you're doing great. If it's something more serious, we need to step in and take care of you. There are other things that can cause shortness of breath. I'm not going to go into all of those, but my guess is some of you watching have had a medical problem. Feel free to share it. We would love to hear your experience, and sharing that with the community of Yerbba viewers is wonderful. And as always, thank you for watching.